Hi, welcome to Maelove. Today we address the question, what causes hyperpigmentation during pregnancy and what can I do about it? Pregnancy can cause hyperpigmentation because the placenta is an endocrine organ and it releases hormones such as estrogen and progesterone. And extra amounts of estrogen and progesterone can overstimulate melanocytes, the skin cells that produce melanin, which in turn can lead to hyperpigmentation. These hormonal effects can cause hyperpigmentation even when not pregnant, such as during the menstrual cycle and when taking oral contraceptives. There aren't many ingredients to treat hyperpigmentation that are declared safe to use during pregnancy. Here are some options. Sunscreen, which doesn't reverse hyperpigmentation, but definitely helps to prevent it. And then there's vitamin C and azelaic acid for treatments. If you're new here, my name is Jackie and I'm the CEO and Chief Product Obsessor here at Maelove. To state the obvious, this video should not be used as a substitute for direct medical advice from your doctor. As usual, the full write-up of this video is available by clicking on the link below. And I recommend that you also check out our video on pregnancy and acne, where we go deeper into the background information on FDA ratings for pregnancy-safe ingredients. You can find the link to that video below in the description box. First of all, for so many skincare ingredients, there is just not that much data about its safety of use during pregnancy, and there is even less data about using ingredients during breastfeeding. And the reason is simple. People are reluctant to run tests on pregnant women, and rightly so. But the flip side is that pregnant women are having to make choices with the lack of good data, so it's generally advised to err on the side of caution. Common changes during pregnancy in skin, hair, and nails. Pregnancy is a time when your body undergoes many rapid hormonal changes, and a large majority, around 90% of women, notice some changes in their skin. And the most common skin changes are hyperpigmentation and stretch marks. Changes in hair are also common, and it may include hirsutism, which means excessive hair growth in the face, chest, and back. However, some changes could be good depending on where. Like, some of you may notice a lusher mane and fuller hair during pregnancy, which is always welcome. Fortunately or unfortunately, the extra hair on your face and head will fall out after pregnancy. In fact, the prolonged shedding of the excess hair may last for several months or more than a year after pregnancy. Your nails will grow faster during pregnancy as well, but this also resolves during postpartum. Increased estrogen levels can also result in visible vascular changes such as spider veins, reddened palms of hands, and varicose veins, but again, these are also resolved during postpartum. How does pregnancy cause melasma, hyperpigmentation? Now, going back to hyperpigmentation during pregnancy. It may be termed melasma, or older terms include chloasma or mask of pregnancy, since for many women it occurs or worsens during pregnancy. So why does it happen? In part, it's because the placenta is an endocrine organ and it releases hormones such as estrogen and progesterone. This will have wide-ranging effects on your whole body, including your skin. In causing melasma, estrogen stimulates the cells that produce melanin, called melanocytes, and progesterone augments this effect, and together, your melanin production goes into overdrive. Even when not pregnant, the menstrual cycle and oral contraceptives can also cause melasma due to these hormonal interactions with melanocytes, the melanin-producing cells. Melasma often goes away on its own postpartum. However, in many cases, melasma can last for years beyond pregnancy. Today, we will go through what is deemed safe and unsafe to use during pregnancy to treat melasma. First, let's talk about sunscreen. Although your melasma is hormonally driven, you should always use sunscreen regularly. Why? Because sunscreen can prevent melasma from occurring in the first place. Let me tell you about a study conducted by Lacter and colleagues in 2007. They found that daily use of a broad-spectrum sunscreen in pregnant women reduced the rate of new melasma cases by more than 10 times. Without sunscreen, the probability of melasma in pregnancy was observed to be around 53%, and with sunscreen, it dropped drastically to 2.7%. Now, to be fair, this was not a huge study. It involved around 60 women and it tested only one kind of sunscreen, a chemical sunscreen, which is sometimes not recommended during pregnancy. But I think it's safe to say that reducing UV damages goes a long way to preventing melasma in the first place. Now, which sunscreen should you use? You might have heard that chemical sunscreens should be avoided because oxybenzone can get into your bloodstream, what doctors would call systemic circulation. This is why some dermatologists will tell you that if you wish to err on the side of caution, you can avoid chemical sunscreens and use a mineral sunscreen, also called a physical sunscreen, that contains zinc or titanium dioxide. Mineral sunscreens are basically ground up rocks, and they're not absorbable through the skin and into the bloodstream. The drawback, however, of mineral sunscreens is that they tend to be a little bit more sticky and can leave residue on the skin unless you rub it in really well. But I personally think the benefits far outweigh the inconvenience. Especially nowadays, there are plenty of great mineral sunscreens on the market that you can choose from. Topical vitamin C. Vitamin C, also known as ascorbic acid, is a well-known antioxidant. This antioxidant activity also helps to fight off UV damage. Furthermore, vitamin C is also a tyrosinase inhibitor. Tyrosinase is an enzyme that is involved in the production of melanin, which is a pigment responsible for skin color. So, inhibiting tyrosinase reduces the amount of melanin produced, which can help to lighten hyperpigmented areas and improve the overall evenness of the skin tone. A lot of hyperpigmentation fighting ingredients are tyrosinase inhibitors, the most famous being hydroquinone, which we'll discuss in a little bit. Vitamin C, as you know, is ubiquitous in our foods and in all sorts of supplements. Oral vitamin C has been found to be deemed safe to take during pregnancy, obviously within guidelines, with no evidence of harm to the fetus. It has also been rated Category A by the FDA for pregnancy use, which means that vitamin C has been evaluated in clinical trials in pregnant women and has been deemed safe. So with topical vitamin C that you might find in serums, you can be confident that it is safe to use during pregnancy. By the way, we go more in depth about FDA ratings for pregnancy safety in our pregnancy and acne video. I'll include a link to that video below in the description box. Topical azelaic acid. Azelaic acid is another tyrosinase inhibitor just like vitamin C. While azelaic acid may not be a very potent tyrosinase inhibitor, at prescription strength of 20% concentration, it performs comparable to 4% hydroquinone. Non-prescription azelaic acid products top out at 10% concentration. Arbutin and Kojic acid are known to be more potent tyrosinase inhibitors. But if you're pregnant or nursing, then azelaic acid is probably the ingredient that dermatologists recommend the most for treating melasma. Why is that? Because there's more data behind azelaic acid. Azelaic acid is rated Category B by the FDA, which means that it is considered safe based on animal studies. There are no studies of azelaic acid in pregnant human women, but that's the case for most ingredients. In general, Category B ingredients are deemed safe to use during pregnancy, so that's what your doctor would probably recommend. Azelaic acid is a normal constituent of milk, and it is also found in wheat, rye, and barley. So it's something that people ingest all the time, just like vitamin C. Azelaic acid is also antimicrobial, so you might see it featured in anti-acne products as well. If you're pregnant and have skin problems, azelaic acid is a good ingredient to use. Glycolic acid. Glycolic acid works by exfoliating the top layer of the skin, which can help to reduce the appearance of melasma and help to fade it faster. It is important to note, however, that glycolic acid should be used with caution when treating melasma, because melasma can be worsened by sun exposure and glycolic acid can increase the skin's sensitivity to sunlight. Therefore, it is important to use sunscreen and limit sun exposure when using glycolic acid or any other product that exfoliates the skin. Glycolic acid is not expected to be dangerous as only a small amount is absorbed through the skin. It is widely considered safe to use during pregnancy if in a formulation with a concentration of 10% or lower and a pH of 3.5 or higher. Hydroquinone. In terms of treating hyperpigmentation, hydroquinone is considered a highly effective, perhaps the most effective, treatment option by doctors. Hydroquinone is probably the most studied and proven tyrosinase inhibitor out there. However, it comes with a lot of side effects, such as exogenous ochronosis, which is large patches of skin staining, or hydroquinone can go too far and cause permanent skin bleaching at the other extreme end. Hydroquinone is also known to be toxic to melanocytes, the melanin-producing skin cells. For these reasons, hydroquinone is actually banned in Europe, and it was almost banned in the US, but now it is available by prescription only. Now, when it comes to pregnancy, there are many more problems because hydroquinone is really good at penetrating the skin and can get into your bloodstream. It is estimated that out of the hydroquinone that is topically applied, 35 to 45% of that amount can get into your bloodstream. This is a ton because most skincare ingredients do not reach your bloodstream at all. So, hydroquinone has two things going against it. First, that it already has a reputation for toxicity, and second, that it gets absorbed into the skin and seeps into the bloodstream so easily. Hydroquinone is not known to be particularly toxic to a developing fetus, but if it can be bad for skin cells, then why even risk exposing your growing fetus to it? Do not use hydroquinone if you're pregnant. And even if you're not pregnant, you can use a combination of safer ingredients like Arbutin and Kojic Acid instead to achieve great results. Hydroquinone is often prescribed with a corticosteroid, which also must be taken with caution during pregnancy as corticosteroids can stunt fetal growth. Retinoids. Retinoids are a true do-it-all ingredient. It is the first ingredient mentioned for aging skin and acne, and it is also one of the top ingredients used to treat hyperpigmentation. But retinoids, both oral and topical, are considered unsafe to use while pregnant due to the risk of birth defects. Retinoids are vitamin A derivatives, and vitamin A is crucial for many functions in the body, including proper fetal development. The problem actually lies in the high amounts of vitamin A that can enter your blood circulation when taking retinoids. These high amounts lead to birth defects in your developing fetus, sometimes called retinoid embryopathy. In fact, when Accutane, which is an oral retinoid, was first introduced in 1982, there were hundreds of reports of birth defects that occurred as a result. So it's not like anyone deliberately ran tests on pregnant women to see if retinoids caused birth defects. However, we had to learn from painful experiences to not prescribe this anymore to pregnant women. Topical retinoids are much less likely to reach your bloodstream than oral retinoids. And clinical studies suggest that topical retinoids like tretinoin do not raise overall vitamin A levels in the blood, nor do they lead to retinoid embryopathy. However, there are reported cases and anecdotal evidence that topical retinoid use is associated with birth defects in rare instances. So it's just not worth it. Overall, considering there are other options to treat hyperpigmentation, retinoids during pregnancy are a hard no. Arbutin. Arbutin is a compound derived from the bearberry plant that is also a tyrosinase inhibitor like hydroquinone and vitamin C, as we discussed earlier. Alpha-arbutin is a form of arbutin commonly found in skincare products. There are some concerns that arbutin can break down in a process called hydrolysis and become hydroquinone. This concern over arbutin is based on studies that have shown that skin bacteria and UV rays can lead to hydrolysis of alpha-arbutin into hydroquinone. However, the studies also suggest that only a small amount is hydrolyzed into hydroquinone. But due to this association with hydroquinone, some dermatologists will recommend that pregnant women do not use arbutin. At Maelove, we recommend that you first speak with your doctor about arbutin if you're interested in using it. Personally, as a pregnant woman myself, I have been using this ingredient in our Fade Away Brightening Serum. But do what feels comfortable for you and consult with your doctor with any concerns that you may have. Tranexamic Acid. I had mentioned earlier that during pregnancy, estrogen and progesterone hormone levels can get elevated, and these elevated levels of hormones can stimulate melanocytes into overproducing melanin. Tranexamic acid tackles melasma in a way that specifically treats hormonally driven hyperpigmentation. This is because tranexamic acid inhibits plasminogen and plasmin, which are believed to be involved in an in-between step between estrogen and melanocyte stimulation. It appears to be safe in pregnancy. In fact, oral tranexamic acid is used in pregnant women to prevent hemorrhage, as tranexamic acid is also involved in blood clotting. So, topical tranexamic acid is rated category B by the FDA, which means it generally is considered safe. That being said, because high concentrations of tranexamic acid can cause blood clotting, some dermatologists and OBGYNs may have differing recommendations on whether to use it during pregnancy for hyperpigmentation. At Maelove, we feel it would be a good idea to speak with your dermatologist and OBGYN if you're interested in using tranexamic acid during pregnancy. Kojic acid. Kojic acid is another tyrosinase inhibitor. When applied on the skin, it doesn't seem to reach the bloodstream, so it has what medical professionals would call low systemic absorption, which is good for pregnancy. There also have been animal studies that showed no risk to fetal development. However, there have been no human studies, and furthermore, the FDA has no official rating on kojic acid. For this reason, some doctors would err on the side of caution and not recommend kojic acid during pregnancy, while other doctors would say kojic acid is fine. At Maelove, we recommend that you first speak with your doctor about this ingredient to get their opinion. I have been using kojic acid along with Arbutin in our Fade Away Brightening Serum as a pregnant woman. But, as always, do what feels comfortable for you and consult with your doctor first with any concerns that you may have. Laser and light therapy. And finally, this is not a skincare product, but resurfacing with fractionated laser is FDA approved to be used to treat melasma. Intense pulsed light therapy, also known as IPL, has also shown promise as well. With these laser therapies, there are risks of post-inflammatory hyperpigmentation, which potentially worsens the problem. Because of this, laser and light therapies are usually recommended only after topical treatments have failed. While laser and light therapies are generally regarded as safe to use during pregnancy, the numbing solution could affect the developing fetus. Hence, consult a dermatologist before getting a laser treatment. So to recap, the first thing to do is to be cautious about sun exposure so that you can minimize the chance of getting melasma in the first place. Azelaic acid and vitamin C appear to be the least controversial ingredients to use during pregnancy, as well as glycolic acid. Arbutin, tranexamic acid, and kojic acid are all great ingredients for melasma, but since there may be differing opinions on these ingredients during pregnancy use, run it by your doctor first. And finally, hydroquinone and retinoids should be avoided during pregnancy. That's it for today. Please click on the link below for the write-up of this video. And if you like this type of content, make sure you like and subscribe. Thanks, and see you next time.